Alright, so last time we discussed about the remedy iodine, and before that we were discussing some building blocks for our body, which is calcarea phos, and in continuation with something that is essential for growth is another remedy that we will discuss today, and the remedy is thyroidinum. So, one of the top remedies that we should think of in all cases of thyroids, but the manner of prescribing is everything in homeopathy. Tyler says in her book, Tyler Drug Pictures, that homeopathic medicines and their prescription is easy, but their manner of prescribing is an art. Once you learn this art of prescribing different medicines at different potencies in different pathologies, you're going to master and excel the different pathologies that you will be seeing in your clinics. Homeopaths should not only be just seeing patients which are cold, cough, skin allergies, joint problems, backaches, but real cross pathologies of the heart, of the joints, of the brain, of the different pathological organs. And if you want to master that, this drug is one of the remedies which is going to be your sheet anchors for prescribing in all the thyroid cases. So the first line that is mentioned is that it is indicated in conditions of depression. There is also a state which is mentioned, which is a sudden acute mania, mixed edema is mentioned, and that state was perfectly restored with the medicine thyroidinum. There was some great mood swings. There was violence in a patient, which was followed by depression and moroseness. This state was also restored by thyroidinum. This is what author Allen says in his book. And if we are to believe and prescribe on this basis, it's going to help us a lot. There will be patients who will be more or less showing you traits that are more in angry in nature, more violent in nature, or their relatives will tell you that this is how the patient behaves. Sudden changes is there, sudden mood changes is there. We think of prescribing ignatia, but the patient can be hyperthyroid, and that is why he is behaving like that. So sudden acute manias occurring, which you see sudden mood changes, good and bad, can be a case of hyperthyroidism, and you should think of thyroidinum as one of the top remedies. Next is there is state of idiocy, frightful nightmares, very excited state followed by a state of considerable depression. So there is a considerable depression and excitement, or excitement and depression, whichever wave comes first. It follows by a completely opposite state. If you see that in any patient, you will mostly see it in patients who are young females or patients around 35-40 years of age. The patient may alone come to you in your clinic, but you can ask about them being comfortable in answering these questions, which require them to be open to their own behavior and scrutiny of their own behavior, critical to other people's opinion, how they are reacting to it. If they are very much hyper, very much angry, very much alternating state, they will say this is a subjective symptom. You will be able to prescribe thyroidinum in potency and see the changes. There is irritability, ill temper, becomes a grumbler, angry, and had fights. So we all see the same situation which is present in lycopodium, and the same situation we will be prescribing thyroidinum for. There will be vertigo, feeling of lightness in the brain, scarcely amounting to giddiness, much giddiness and headache for 24 hours after the medicine is prescribed. So thyroidinum is a remedy which will have all the symptoms of hyperthyroid or extreme opposite, which is hypothyroid, and you can use this remedy in both the scenarios provided you know how to use it, when to repeat it. So there will be cases which will require deep acting polycrest remedies like calcarea carb, phosphorus, silica, sepia, natramute. Thyroidinum will work as an intercurrent to, act like a cushion for these deeper polycrest remedies. Once you develop this technique, you will be able to master different types of patients in the clinic. Next, you have in the head symptoms itself, there is exactly at 4 a.m. there is headache, intense backache, limbs which had continued for 3 days and compelled him to be on his bed. There is constant pain in the occiput and in the vertex, and there are cases of acromegaly or something that is overgrowth that has happened in the body. And we saw that in iodine, cases of iodine, there is limited growth, reduced growth or restricted growth, whereas in thyroidinum there is overgrowth that you will see in different organs or different parts of the body. Next you have is, in cases of myxedema, the patient lost all the hair of his head and the face and had a thick growth of hair on his arms and thorax, and under thyroidinum the hair of the head and the face grew again, and the arms and that of the arms and chest fell down. So you will see this irregular distribution of hair where it is not intended to be. You will find in those locations. Those are the cases for prescribing thyroidinum. Next you have is prominence of eyeballs. You see this mostly in cases of goiter. Patients who are bordering on goiter also will be having these complaints, and in this scenario there will be protruding eyeballs, someone who is opening his eyes as if he has not slept for so many days. Looks very scary, but that will be the case, or those will be the patients that you will prescribe thyroidinum in the highest potency. Next you have is accommodative asthenopia, optic neuritis. There was no other symptom in most of the patients except optic neuritis. Then there are some skin complaints, especially behind the ears. We often tend to give remedies like graphitis, petroleum. In fact, sanicula is one of the top remedies which we should think of in cases of eruption behind the ear. But do think of thyroidinum in cases of moist patches behind the ears, especially cases of psoriasis, and if it also involves the bones inside the ear or behind the ear region, think of thyroidinum very strongly indicated in such cases. Next you have is faintness with flushes of the heat in the upper part of the body, tongue is thickly coated, feverishness or feeling thirsty all the time, lot of thirst. Typical cases of arsenic will be landed in your clinic. You will require to give them arsenic. Thyroidinum will be one of the remedies which you can think in as an intercurrent remedy and not as a regular prescription. Next you have is rapid and fast pulse tachycardia. All the patients of thyroid need a heart evaluation. Get them checked up with a heart specialist. Get their ECG done. You will see that there is tachycardia, and there is more of a reduced space of QR complex where you will require to prescribe thyroidinum as a potency. Next you have is for the appetite, increased appetite, improved digestion, irritation, dyspeptic troubles, nausea with flushing and lumbar pains. Always felt a sensation of sickness after the injections. Sensation of faintness and nausea and gastrointestinal disturbance and diarrhea. So all those cases very common symptoms are there of the gastric disturbance. Nothing to be prescriptive, nothing of prescriptive importance is seen over here. But what you will see is that cases of diabetes and thyroid conjointly present in any individual should be given a thought that thyroidinum will work. Albuminuria, increased flow of urine, should be given a thought for thyroidinum. Next you have is female reproductive system, irregular menstruation. We see this in most of the cases of thyroid, hyperthyroid or hypothyroid. There is more of a left ovarian pain and great tenderness seen in such females. And what is best part is that the thyroidinum as a remedy acts as a galagogue when the milk is deficient. We saw this in the remedy lactifluoratum. In fact, there are other remedies also in the Materia Medica which work like this. Thyroidinum can serve as a one of the remedies for restoring the milk. And next you have is flushes in certain parts of the body, irregular distribution of the heat and the hair. Also we saw in the earlier part of the lecture, also in the mention of the Allen's keynotes. For the lower limbs, there is edema of the legs, subsequently subsided and continued to reappear and subside for a month. There is profuse flow of fluid from the feet in cases of dropsies, which are cured by thyroidinum. Next is acromegaly and subjective symptoms. You will see this very clearly. This is an overgrowth manifestation of thyroidinum. For skin symptoms, you have psoriasis, especially behind the ears, folds of the body, different parts of the body, and there is flushing of the skin. There is lot of heat in that part or lot of itching in that part, which will be indicative of thyroidinum. Next you have is lot of continual tendency to sleep or diametrically opposite symptom, which is insomnia. And then generalities, it's a big remedy mentioned in Allen's keynotes, thyroidinum, but if we make it concise, you will see that there is more of a peculiar symptoms which keeps on repeating. For example, flushing of heat, irregular distribution of hair, irregular distribution of the heat, and there is chilliness which makes them not better by anything. Next you have is hysterical attacks and hysteroepilepsy with amenorrhea. Patients who don't have menses at regular times, the menses have been stopped, they will develop nervous symptoms. Those should be the cases for thyroidinum to be prescribed. And you will have anemia and debility also in many of the cases. Last but not the least, there is more of a lot of weight loss beyond proportion to the age of the patient and height of the patient. In such cases, thyroidinum should be strongly thought of. Mostly it is to be thought in cases where there is irregular distribution of hair, irregular distribution of heat, flushes of heat, overgrowths that have happened. We saw the opposite in iodine, indurations or restriction of growth, and thyroidinum there is overgrowth which is happening, over exaggeration of behavior that is happening. That should be the case for prescription of thyroidinum. I hope this has helped you to understand thyroidinum, and do let me know in the comments what is your experience of giving thyroidinum as a medicine.